Hi, I'm Mark Barlow. I'm one of the emergency physicians from Hawke's Bay Regional Hospital, and I've become involved in CareInsight just through the clinical support officer, looking at a way in which we could just increase the availability of health information about patients who present to the emergency department, particularly after hours. Often patients presenting to the emergency department have no recollection or limited recollection of what medications they're on or changes to medication, and sometimes they're too sick or unwell to be able to give us that information. After hours, this creates significant difficulties because often the general practitioner's offices are closed or the pharmacy may be closed, and so we really have little idea about what current medication or current medical problems the patient has. CareInsight has been significantly improved our access to health information about these sort of patients. We're able to access a list of current medications and prescriptions and a list of recent and past medical problems on many patients presenting to the emergency department, and this allows us to have more information to make the right decisions about patient management. As an example, we had a patient who presented with a polypharmacy overdose after hours in the emergency department, and the patient was too sedated to give us any information at all. We had no record from previous hospital visits as to what medication that patient was on, and we weren't able to contact their GP or have any knowledge about what their normal pharmacy was. Using CareInsight, we were able to quickly obtain a list of current medications and work out the likely drug that was involved in the overdose. So it made a significant difference to the management of that patient, and there have been numerous other examples as well. Patients have been pretty happy about us being able to access their health information electronically. Often, particularly elderly patients come into hospital and find it really hard to recall all of their medications. We can say to them, look, we can go away, using a computer, we can get a list of medications from your GP, and that'll give us a full list and we'll know exactly what you're on. And they're thrilled about that because it kind of takes the pressure off them to have to remember what all their medications were or carry a list around with them. So we've had lots of positive feedback.